In this video, we'll discuss amnesia, the structures involved in causing amnesia, its different types, and causes. So amnesia or forgetfulness or loss of memory occurs due to damage to structures in limbic system. What structures are included in limbic system? Hippocampus, amygdala, mammillary body, fornix, anterior and medial thalamus, hypothalamus, striatum, and entorhinal cortex. Damage to any of these structures causes loss of recent memory. What's the function of limbic system? Limbic system binds the distributed fragments of memory into one event that can sustain conscious recall. Damage to the structure in limbic system causes amnesia by interfering with their conscious or declarative recall. What are the other functions of limbic system? Emotion, fear, motivation, autonomic tone, and endocrine function. Which structures damage causes loss of emotions and fear? Damage to amygdala causes loss of emotion and fear. What's the role of prefrontal cortex in memory? The central executive part of the prefrontal cortex play a fundamental role in short-term memory, and ventromedial prefrontal cortex has a role in long-term memory storage and recall. So central executive part of prefrontal cortex concerned with short-term memory, and ventromedial prefrontal cortex is concerned with long-term memory storage and recall also. Frontal lobe damage and confusional states caused by toxic metabolic encephalopathy may cause secondary memory impairment in the absence of limbic lesion. So if there is no limbic lesion but frontal lobe damage or toxic metabolic encephalopathy may cause amnesia. What's amnestic state? A disturbance in declarative or conscious memory, not procedural memory, which is a motor skill, is known as amnestic state, and the patient is almost always disoriented in amnestic state. So amnestic state is a disturbance of declarative or conscious memory. What are the conditions that cause amnesia? Emotional trauma or severe stress, psychogenic, delirium, degenerative dementia, intoxication, trauma, tumor, infection, and infarction can cause amnesia. How emotional trauma or severe stress causes amnesia? Elevated levels of enkephalins and corticosteroids have direct effect on hippocampus and produce abnormal neural activity and disrupt long-term potentiation. What's psychogenic amnesia? Psychogenic amnesia is deliberate avoidance of unpleasant memories like death of a loved one. Psychogenic amnesia also occurs from severe drug or alcohol intoxication and with schizophrenia. How concussion is related to amnesia? Transient loss of consciousness associated with short period of amnesia in concussion. Retrograde and anterograde amnesia is typical of concussion, and memory is regained in an orderly way from most distant to recent memories. And what about hysterical post-traumatic amnesia? This one is associated with bizarre behavior. What's fugue state? Fugue state is a sudden loss of personal identity. Person may be found wandering far from home. Memory for recent event and ability to learn and use new information are preserved. Episode usually last hour to days but may last for months. Delirium causes amnesia. There is diffuse cerebral dysfunction, loss of memory, fluctuating level of consciousness, and clouding of consciousness with loss of orientation to time, place, and person. Dementia causes loss of all types of memories due to degenerative changes in the cerebral cortex, hippocampus, frontal, and temporal lobes. What's blackout? Anterograde amnesia following binge drinking. What's Korsakoff syndrome? Severe memory loss with permanent anterograde amnesia. Condition occurs in chronic alcoholic. There is ataxia, agitation, confabulation, ophthalmoplegia, and ocular palsy. It occurs due to vitamin B1 thiamine deficiency and is usually irreversible. In the treatment of Korsakoff syndrome, vitamin B1 thiamine is always given before giving glucose to prevent deterioration of vernix encephalopathy, which is reversible. And what's confabulation? In acute anterograde amnesia, amnesiac state, patient fills memory gaps with inaccurate and fabricated stories. So inaccurate and fabricated stories because of loss of memory. Drug-induced example of amnesia are alcohol intoxication and opioid intoxication. What are the different types of amnesia? Retrograde amnesia, anterograde amnesia, and transient global amnesia. So what's retrograde amnesia? Amnesia for the events of before the injury or disease, or inability to remember events that occurred before trauma or injury. Patient can remember new information but doesn't remember what happened before the injury. Remote memory is not affected. The condition may last, however, for years. What are the causes of retrograde amnesia? Retrograde amnesia may occur due to depression, shock, trauma, Huntington disease, and brain concussion or electric shock therapy. So brain concussion and electric shock therapy also cause retrograde amnesia. Retrograde amnesia is tested by asking biological or historical events. The anterograde amnesia. There is an inability to remember anything after the lesion or subsequent to injury. The amnesia is for the events after the injury or disease. Transient global amnesia. Patient is acutely disoriented with sudden onset of severe episodic memory deficit, usually due to emotional stimulus or physical exertion, and is characterized by anterograde amnesia. During the attack in transient global amnesia, person is conscious, communicating, and there are no neurological signs or symptoms, but there is disorientation to place and time, and impaired recent memory is due to hippocampal dysfunction. Person repeatedly asks about the people and situation. The condition occurs in late middle age and lasts for few hours, and the recurrence rate is 25%. What are the causes of transient global amnesia? Transient ischemic attack, temporal lobe seizures, and migraine can lead to transient global amnesia. Transient ischemic attacks of posterior cerebral arteries may cause transient global amnesia also. A persistent global amnestic state is always due to bilateral damage to structures in the limbic network, usually due to damage in hippocampal, entorhinal, and thalamic areas.